When does a child need a sleep study? That's the question we're going to try to answer here today. What exactly is a sleep study? I spend a lot of my time reading sleep studies, actually. It's a big part of being a sleep physician, interpreting sleep studies and giving some clinical recommendations. And what sleep studies are really good for, the main thing is looking for signs of obstructive sleep apnea. It's a great test for breathing while you sleep. It looks to see if a child is having partial or complete blockages in their airway while they sleep that could be disrupting the quality of their overall night. Secondarily, it can also be helpful if you're looking for frequent limb movements, what we call periodic limb movements of sleep at nighttime. So if you have a high suspicion that their sleep is disrupted due to poor quality and you want to assess for limb movements, a sleep study can be useful. That's more of a secondary reason. The primary reason is really still typically breathing. And the third reason is if a child is experiencing excessive sleepiness of unclear etiology, of unclear cause, then a sleep study is performed to make sure there's no problem with the overall sleep quality. It's a part of the test to look for other causes of excessive sleepiness like narcolepsy. So when should you potentially discuss with your pediatrician whether a sleep study is needed? Well, usually it's a child that's snoring plus has some other sign or symptom of sleep apnea. There are practice parameters that dictate the other signs and symptoms, but they include things like snoring plus gasping for air, or daytime issues with attention and hyperactivity, snoring plus having a craniofacial abnormality, having a small chin or a recessed chin, having large tonsils or adenoids. All of those things can be the +1 to snoring. So snoring plus something else usually merits a sleep study for further evaluation. But again, talk to your pediatrician if you feel like your child may benefit from a study. All right, hope that's helpful. Sleep well, everyone.